Hey everyone, Dr. Mike here from Breaking Diabetes. Today I'm going to debunk what everyone tries to convince you about diabetes. You know, when they tell you never eat chocolate again, or you can't have a beer with friends. Well, I've got some explosive news for you. A lot of what you've heard about diabetes is completely false. After more than 15 years treating diabetic patients in my clinic, I've seen so many people unnecessarily limiting their lives, afraid to eat fruit or thinking they're doomed to a lifetime of medications. Today, I'm going to reveal the 10 biggest myths about diabetes that continue to be perpetuated even by some healthcare professionals. In the next few minutes, you'll discover if you can really eat sweets, have that weekend beer, and which fruits are actually suitable for people with diabetes. And at the end, I'll give you an exclusive bonus with the 7 most powerful strategies I use with my patients to control blood sugar naturally. This might be the most important video you'll watch this year if you have diabetes, prediabetes, or know someone with high blood sugar. So stick around until the end. The 10 biggest myths about diabetes. Let's start from the bottom with myth number 10 and work our way up to the most common one, which I'm sure you've heard hundreds of times. Myth 10. If nobody in my family has diabetes, I'm protected. This is one of the most dangerous false senses of security out there. The numbers don't lie. In 1980, we had 108 million diabetics worldwide. In 2021, it skyrocketed to 537 million. This astronomical increase didn't happen just because of genetics. It's true that having diabetic parents increases your risk by about 50%. But what's really causing this diabetes epidemic are our modern habits, ultra-processed foods, sedentary lifestyle, and chronic stress. Genetics loads the gun, but lifestyle pulls the trigger. And the good news? You can control that trigger with your daily choices. Myth 9. Prediabetes always develops into diabetes. If you received a prediabetes diagnosis and thought your fate was sealed, take a deep breath. In Brazil, we have over 40 million prediabetics. No, how many will develop diabetes in 5 years? Only 25%, and that's if they do nothing about it. Prediabetes is like a yellow traffic light, a warning, not a sentence. It's your body saying, hey, something's not right here, time to change course. With lifestyle changes, you can not only prevent progression to diabetes, but also completely reverse prediabetes. I have dozens of patients who've done exactly that. Myth 8. I heal well, so I can't have diabetes. This belief is particularly dangerous because it means 4 out of 10 diabetics don't know they have the disease. Type 2 diabetes, which represents 95% of cases, is silent as a ninja. It infiltrates your body without obvious symptoms. Poor healing is a late symptom that only appears when the disease has already caused significant damage to blood vessels and nerves. When you notice healing problems, the train left the station a long time ago. It's like that wall leak you only notice when the paint has already started to peel. Early diagnosis requires regular blood tests, fasting glucose, glycated hemoglobin, and glucose tolerance test. It's not guesswork, it's science. Myth 7. I don't eat sweets, just salty food, so I'm protected. I hear this almost every day in my office. Dr. Mike, I don't even like sweets. How can it be diabetes? Here's the truth. It's not sweets that directly cause diabetes. What causes diabetes is caloric excess and weight gain, especially abdominal fat accumulation. Too much pizza, pasta, rice, or any food in excessive amounts can lead to weight gain and, consequently, diabetes. Your pancreas doesn't differentiate whether the excess came from a chocolate cake or a giant plate of pasta. And remember, type 1 diabetes is autoimmune. It has nothing to do with your diet or choices. It's your immune system attacking insulin-producing cells. Myth 6. Taking diabetes medication means my condition is getting worse. This myth keeps many people suffering unnecessarily. Metformin can reduce by 31% the risk of a pre-diabetic developing type 2 diabetes. That's not opinion, it's the result of the scientific study DPP, Diabetes Prevention Program. The goal isn't to avoid medication at all costs. It's to control your blood sugar to prevent complications. If diet and exercise aren't enough, modern medications can literally save your organs from irreversible damage. Refusing medication when needed is like refusing a fire extinguisher during a fire because you prefer natural methods of putting out fires. We have medications that provably reduce cardiovascular, kidney, and eye risks in diabetics. And in November 2022, the FDA approved the first medication in 100 years capable of altering the course of type 1 diabetes. Hey, are you enjoying these revelations? Before continuing with the next myths, tell me in the comments, do you have diabetes or prediabetes? Which of these myths have you believed? And which part of the country or world are you watching from? Share your experience. And if this content is helpful, don't forget to leave your like and subscribe to Breaking Diabetes. Now let's move on to the 5 most common myths. Myth 5. Diabetes only affects overweight or obese people. This is one of the most frequent comments I receive. Dr. Mike, how can I have diabetes if I'm not obese? Although overweight and obesity are significant risk factors, about 11% of people with type 2 diabetes have normal weight, according to American CDC data. And remember, type 1 diabetes has absolutely no relationship with body weight. It's an autoimmune condition. Genetics, age, diet composition, and other factors can lead to diabetes even in thin people. I have marathon runner patients with type 2 diabetes. Myth 4. Once diabetic, always diabetic. This is a discouraging lie that prevents many people from taking action. The truth? Type 2 diabetes remission exists. Studies show that people who lose significant weight, especially right after diagnosis, can completely reverse the condition. Bariatric surgery has shown impressive remission rates, with many patients maintaining glycated hemoglobin below 6.5% without medication for years. Of course, this doesn't mean you can return to old habits afterward. Diabetes is like a hibernating bear. If you create the right conditions again, it wakes up. Not everyone will achieve complete remission, but science advances rapidly. The treatment we have today is infinitely better than 10 years ago, and what we'll have in 5 years will probably revolutionize the field again. Myth 3. Diabetics can't consume alcohol. We've reached the top 3, and this is a myth that seriously affects the social life quality of many diabetics. Diabetics can indeed drink alcohol, but with moderation and additional care. The golden rule: never drink on an empty stomach. While your liver is processing alcohol, it can't release stored glucose, which can lead to dangerous hypoglycemia. Certain diabetes medications like insulin and sulfonylureas increase this risk even more. That's why in the emergency room, people with alcohol intoxication often receive intravenous glucose. Alcohol also has many calories, about 7 calories per gram, more than carbohydrates, 4 calories per g, and close to fats, 9 calories per g. If you're trying to lose weight, this is an important factor. So, an occasional glass of wine? You can. Weekend beer? Moderately, yes. Daily shots? Better avoid. Myth 2. Diabetics can't eat fruit. This myth particularly irritates me because it deprives people of essential nutritious foods. Fruits contain natural sugars, yes, but they come packed with fiber, vitamins, minerals, and antioxidants that protect against numerous chronic diseases. There are no forbidden fruits for diabetics. What exists is the need for portion and frequency control, especially for fruits with higher glycemic index. A whole fruit is always better than juice, as the fruit's fiber slows sugar absorption. And eating a moderate portion, even of sweeter fruits like mango or banana, is infinitely better than eating a cookie or processed cake. Myth 1. Diabetics can't eat sweets. Ever. And we've reached myth number 1, which I'm sure you've heard 1,000 times. Diabetics should completely eliminate sweets from their diet. This simply isn't true. You can eat sweets occasionally, in controlled portions, as part of a balanced diet. Special occasions like birthdays, end-of-year parties, or important celebration can include a small dessert without drastically compromising your glycemic control, as long as it's the exception, not the rule. And what about those diabetic products? Often they're expensive traps. They may not have sugar, but they're usually rich in fats, calories, and artificial sweeteners. In many cases, it's better to consume a small portion of the normal product occasionally. The diet for people with diabetes is the same healthy diet recommended for everyone: balanced, varied, with real foods and minimal processing. Bonus: 7 powerful strategies to control your blood sugar. As promised, here are the 7 strategies that transformed my patients' lives. 1. Prioritize quality sleep. A bad night's sleep increases cortisol, causes insulin resistance, and intensifies hunger, especially for carbohydrates and sugars. For diabetics, sleeping poorly is like pouring gasoline on fire. Aim for 7 to 9 hours of quality sleep every night. 2. Stay properly hydrated. Dehydration affects diabetics more intensely. Sufficient water helps regulate blood sugar and reduces cravings for sugar. Drink at least 2 liters per day, ideally plain water or with a touch of lemon. 3. Increase fiber intake. Fibers are your secret allies against blood sugar spikes. They slow down carbohydrate absorption and increase satiety. Vegetables, legumes, fruits with skin, and whole grains are excellent sources. 4. Consume foods rich in magnesium and chromium. These minerals are essential for glucose metabolism. Dark green leaves, seeds, nuts, whole grains, and legumes are rich in magnesium. For chromium, go for apples, bananas, broccoli, and potatoes. 5. Manage stress. Chronic stress elevates cortisol and adrenaline, directly impairing pancreatic function. Although stress alone doesn't cause diabetes, it can certainly drastically worsen glycemic control. Meditation, deep breathing, and enjoyable activities are powerful medicines. 6. Exercise regularly. 150 minutes of physical activity per week is the minimum recommended. Ideally, combine aerobic exercises, walking, swimming, cycling, with strength training. Exercise increases insulin sensitivity, reduces stress, and aids in weight loss. 7. Lose weight, especially from the abdominal region. Visceral fat, belly fat, is metabolically active and significantly increases insulin resistance and inflammation. Even a modest loss of 5 to 10% of body weight can bring substantial benefits for glycemic control. Conclusion: these 10 lies about diabetes continue to circulate and unnecessarily limit the lives of millions of people. Knowledge is power, and now you have the power to make more informed choices. Remember, diabetes is a serious condition that requires attention and care, but it's not a sentence of deprivation or suffering. With the right strategies, you can live a full, flavorful, and healthy life. If this video was helpful to you, share it with someone who needs this information. Leave your like, subscribe to Breaking Diabetes, and hit the bell to not miss any content. I'm here to help you break the chains of diabetes and regain control of your health. See you in the next video.